chronic UTIs can have a similar pain cycle to what happens with painful sex, where maybe there's an initial trigger that, it's an infection, it's a trauma, something that creates that initial painful penetration. But then your muscles and your brain create this pain response cycle where you're actually developing pain preventatively in advance of penetration.
Welcome to Fempower Health. Georgie here. According to a recent study that looked at 25,000 women, it found that at least 32% have a pelvic floor disorder. It is actually estimated in other data that over 40 million women in the US alone have a pelvic floor disorder at some point in their life. However, there's only about 5,000 providers with expertise to support this. So I am pleased to bring to you Carine Carmy, who is the co-founder of Origin, which offers virtual and in-person visits for pregnancy, postpartum, sexual health, and menopause. And we are here today to be educated on what good pelvic floor function is, because so much of women's health is normalized and we aren't taught enough about our bodies. If something is going wrong, how do we know what that might be? And so we talk about what you should be expecting as you age with your pelvic floor and how best to be proactive. And if you are interested in going into depth in some of the conversations we cover today, feel free to check out my Spotify playlist by going to fempower-health/Spotify. And now let's hear from Carine. Carine, it's so nice to have you on the Fempower Health podcast. I can't believe, what was it, a few months ago in September that we met at Delphine O'Rourke's office in was it Times Square? Yeah, it was Times Square area.
Yeah.
What a beautiful space, by the way. And it was great to see you on a panel discussion talking about your expertise in the women's health space. And I actually had Delphine on the podcast right after that to talk about her perspective as an attorney on the impact of overall women's health with the overturning of Roe v. Wade. So that was a really, really interesting discussion.
Yeah.
So if anyone wants to hear back on that, certainly we agree that that blew women's health out of the water and the gaps that we have in healthcare. So I'm sure we'll be covering a little bit of your experience with that as well today. So before we dive into talking about pelvic floor health, I'd love for you to share your background and how you got to where you are today. And by the way, you're 37 weeks pregnant. So thank you so much for making time. And by the time this episode goes live, you're going to have a cute little bundle of joy. So I can't wait to get the updates. But yes, tell us your story.
Amazing. Well, thank you so much for having me. It's a pleasure. And for all the work you do to elevate these really important topics, which, hopefully in the future just become so ubiquitous that we don't even need to talk about it. But today, it requires this deep focus. So thank you for your work. So my background has been in healthcare and technology most of my career. I started as a management consultant and then have the crazy need to keep building startups over and over again. So Origin is the fifth startup I've built and been involved with, the third that's venture backed and the first in this kind of co-founder CEO role. So I like to joke that I enjoy type 2 fun, the kinds of things like climbing mountains and building companies. But it really all cemented for me in 2018. I had spent a lot of my time in digital healthcare at various startups and had seen, the shifts of the ecosystem, but was also finding myself really disconnected from the end impact of my work, working in companies that were B2B to B2C. And, I'm like, add more acronyms between, you and the end patient. And so I decided to take some time off and moved from San Francisco back down to LA, where I grew up, and was doing a lot of actual work physically to deal with some chronic issues I had swept under the rug for a long time. I have IBD, ulcerative colitis, and I'd also had a history of about 10 years of vulvodynia or painful sex. I was originally diagnosed in my early 20s in New York, and I was going to, Cornell Med, like some of the best medical institutions in the country. And yet they, one, took a very long time to get, even the name of the diagnosis, and, probably didn't even get that right in the early days. I had biopsies done, which was really counter to what is the plan of care for this kind of work. And I was never referred to a physical therapist. So, their plan of care was like, try this cream, have a glass of wine, and maybe it'll go away. And, you know,
Unbelievable.
exactly. Yeah. We're rolling our eyes over here if you're listening. And so it was one of those moments where I wasn't actually actively trying to, get support for this, but I connected with an old friend who's now one of my co-founders. She had just had her first son, and she was experiencing a host of pelvic floor issues, including painful sex, but also incontinence and, discomfort sitting. And she was referred to a physical therapist here in LA. And I said, wait, you can go to a PT for your pelvic floor? Like, what does that even mean? And we ended up at the same practice. And the care, was life changing. And in 2 sessions, I finally, really understood what was going on with my body. I had a plan of care. Most of it was really non-invasive, like learn how to breathe properly, how to downtrain my pelvic floor, and actually just reconnect to my body in this very, very powerful way. It was, I say, life changing because it was not only this physical shift, and obviously having a positive sex life is really incredible, but also because I finally understood my own anatomy for the first time. And most women are not taught about the difference between a vulva and a vagina, ever, especially at young ages.
Right.
And so that was this beginning journey for me to understand both how important this work is, but also how underserved and common these issues are. And so that was really the beginning of our origin story. My friend and I ended up partnering with that local clinic, brought in our third co-founder, her husband, and have been partnering with really incredible physical therapists across the country to elevate their work and build a network of both in-person clinics, but also virtual care.
Wow, that is incredible. What a
Yeah.
change the women's health space has been, even in the short time that I really got into it after my 4-year fertility journey. I mean, just it's exploding. So I'm excited today to talk more about pelvic health because it is certainly a popular topic on the podcast. And so for those listening, I do have a Spotify playlist where I just categorize all the topics because there's so many different things that are covered here on the podcast. And, when you and I were aligning, it's like, what can we talk about? Because, as I mentioned, as soon as I met you, I'm like, we have to have an episode together. But what new things can we cover on the podcast that haven't been covered before? And so I love your idea of, since, taking off of what you just said, which is we don't understand our bodies, but our bodies change as we age and as we experience things like pregnancy. And I am sure you're a very good pregnant woman and that you're being proactive about your pelvic health and doing all the
Trying, but
things.
still.
But let's walk through these different life stages and what women, maybe we could talk about what women should expect and what should be monitored, because we don't know what we don't know, and because we live with our bodies every day. Like, here's an example I love to give. So I dated this guy in college, and we dated for a long time after college as well. And we keep in touch. And many years after we had stopped dating, he's like, remember my nephew? He was like 5 years old and so quiet and shy. Well, you won't believe it. Apparently, he was almost blind. And that's why he was shy. But to a kid, he doesn't know, or he or she doesn't know what vision is because they're born and it's like, well, this is just what it is. And through an eye exam with school, they realized he was practically blind. He got glasses and literally transformed into this bubbly young boy. And so I always think about that, and I want to just put that to light to say, like, no, literally, like, we think it's normal, and then worse, because there isn't the data in women's health, and our moms and grandmas and aunts and sisters also think it's normal. We're kind of like in this massive pain is normal, bad is normal, sneezing and peeing is normal, and it's funny. So
Oh, I got chills as you shared that story. Pelvic health, and I'm sure this is familiar to folks on your podcast if they're, listening before, is really just another way of looking at, a part of your body, right? So we think about back health or breast health or, or mental health. And unfortunately, we just haven't had the language, but also the focus from the medical community to ask the right questions of patients so that, to your point, if there is something that is abnormal, dysfunctional or painful, patients can start to articulate that and build that language themselves. And so today, unfortunately, we have to be our own advocates in a different way. And I would say at the highest level, if there's ever pain that folks are experiencing, discomfort, things that don't feel right intuitively, that is, the beginning of a conversation with a medical provider. And if that provider is not asking you the right questions, time to find someone else. And I'm sharing that because what we have normalized are so many sets of issues. And so let's even just start talking about what happens, in your teenage years. Obviously, you start menstruating and you can have really severe cramps. Or what we sometimes see from our patients are things that present as chronic UTIs, but it's actually pelvic floor dysfunction. And so there are some really interesting things you can do where you're maybe not solving the root cause, let's say in the menstrual cramp issue, but you can find comfort measures through pelvic floor therapy interventions.
Can you tell me more about the chronic UTIs? I have to stop you there because now I'm dying to know because I have so many friends with daughters who talk about this, and I actually have done an episode on UTIs. And I'm
Yeah.
now curious what you're going to say versus what this MD had to say because she's an OBGYN by training. And as we know, subspecialists are so critical in our healthcare system because they know the nuances for someone who has more general training just wouldn't have training on it. I'm not saying she's right or wrong, but I'm just so curious.
Yeah. Well, chronic UTIs are interesting because sometimes you're not actually getting the culture every time. And so you don't know if there's actually, a bacterial infection, but you can present with symptoms that feel like a UTI. But if they're happening more regularly and you're not getting this set of positive, infection data back, there could actually be pelvic floor spasm or muscular issues that are creating the feelings that are often associated with a UTI. Chronic UTIs can have a similar pain cycle to what happens with painful sex, where maybe there's an initial trigger that it's an infection, it's a trauma, something that creates that initial painful penetration. But then your muscles and your brain create this pain response cycle where you're actually developing pain preventatively in advance of penetration. And so, pain is often in this brain body connection, which we obviously know a lot more about today than we ever did in the past. And with chronic UTIs, there's not a ton of research. And so I don't want to, speak out of turn from a clinical standpoint, but oftentimes the symptoms of what someone thinks is a UTI is actually pelvic floor dysfunction or muscle spasm. And so if you are someone or your daughter or anyone in your life has been having series of antibiotics again and again and again and it's not working, that's a point where you could actually think about, like, let me go check out the musculoskeletal system and see if there's anything else happening here where I'm creating that spasm or that tension.
UTIs, it's black and white in that you get the culture, and if it comes back positive, it's a UTI. If it's negative, it's not.
Yeah,
So, what I'm now unclear on, and I just think this is important for people to understand, because why can't we just all say, "Can I get the
the
culture?"
culture. Yeah. And I don't know enough about what's happening today with, like, online pharmacies, over the counter medicine, but I do know, even in my own experience, I've been able to get UTI medication without going in to get the culture. And it's not necessarily, I've wanted that, and so I don't wanna put that back on the medical community. We shouldn't necessarily have barriers to getting that kind of medication, but if it's happening really regularly, that's when you really wanna make sure you're getting the culture. On our blog too, we have a lot of resources, so if you're, experiencing any of these things, obviously, you can read more. It's all clinically informed, and obviously talk to a medical professional too. And I should note, I am not a PT, so I am, a highly informed, slightly dangerous business person who cares a lot about these issues. Also, what we see, in teenage years, there could be menopause pain. No, excuse me, not menopause, menstrual pain, chronic UTIs. Incontinence can often start with young athletes. So with gymnasts, with runners, who have really high impact training, but are not necessarily getting full body training around pelvic floor, you can start to see incontinence develop at that age. And it can be really challenging and embarrassing as a young teen to be leaking, during your races, even fecal incontinence too. And so that's something that's very I don't want to say very common, but increasingly common among, young athletes who are not getting that whole body training and are starting to, leak at the end of a race, for example. And so that's a really important opportunity to say, okay, this is not normal. How do I get that kind of care? Um, and then there are all the issues that could present, depending on, your age and when these diagnoses could happen, but PCOS, endometriosis, kind of earlier presentations of things that will become chronic pelvic pain that again are not fully addressed by physical therapy, but you really want to make sure you're supporting yourself with some of the pain management and musculoskeletal interventions, from that early age.
Wow.
And so, yeah, it's basically right. It's a body part, right? Like it's your back or your legs. There are so many different things that can impact this set of muscles and this whole system. And so we often think about pelvic floor therapy as great. Like, let me do my Kegels after I have a baby so I don't pee my pants. But it's really so much more than that. And also, tied to orgasm and pleasure as well. And oftentimes we think about Kegels, and I joke and I love Kegels because it's how we've normalized and talk about this issue. But sometimes if you have a hypotonic pelvic floor, so a tight pelvic floor, which is very present in painful sex. So in my case, if you can't lengthen your muscles and release, you actually are maybe not able to have the full spectrum of orgasm, because the orgasm is basically the full contraction and release as well. And so this is not just about pain management, but it's also about pleasure, which I know is hard for the medical community to wrap their head around, but is really critical. And I've had a lot of friends who have had trouble orgasming who also then have some of these other symptoms at the same time. And it's just not something that we are taught, about. And obviously, there's a lot of lack of dialogue around pleasure in general for women.
How do we know what the ideal orgasm is?
Well, I don't want anyone to feel like there's an ideal, but
And I'm
yeah.
not getting at
So
that, but it's more of like, wow, if I can have more, I'd probably want more. Like, so have I reached the possibility of where I can be
yeah,
if I had a healthy pelvic floor?
exactly. Well, and I think it's more if someone has felt like, hey, I'm watching these movies, and obviously movies are not the best way to see what an orgasm looks like. But I talk to my friends, or I feel like I'm not having that full
Okay.
experience, or I'm not enjoying myself, or I can't relax. Like I think a lot of the times, especially I joke about like people living. I was living in New York, and so you're very tense all the time.
Yes.
If the relaxation techniques and kind of relaxing your body are not as intuitive to you, that might be an early indication. And so something just to think about is also, what kind of warm up are you having, or earlier things are you doing with your partner to get into that state so that your pelvic floor can both fully contract but then also fully relax.
I think that will be
Yeah.
motivating for people to get a healthy pelvic floor. And since you were talking about the Kegels, tell us about misperceptions there, and then we'll dive into other phases of life because I do think people oversimplify it. And I think on every single episode,
Mhm.
we do talk about this. So apologies if you're listening to all the episodes. We cannot underestimate the lack of understanding around Kegels. So share your
Yeah.
thoughts, please.
Well, I would love to hear, and I'll listen back to hear everyone else's thoughts too. But at the highest level, Kegels are a shorthand for thinking about pelvic floor strength, right? And it's the contraction in the context of, as we were just talking about, orgasm, painful sex, even other aspects of just healthy function of muscles. You want to both contract and you want to be able to lengthen and release. And oftentimes, actually, patients who are having pelvic floor dysfunction should not be doing Kegels because you're overactivating an active pelvic floor that's in a hyper state of tension. It's as if my shoulders are always up and I'm now doing really heavy shoulder exercises, and I never let my shoulders learn how to relax, when I should actually be doing more stretching and more opening.
Ooh, that's a great depiction. I love that. I'm glad I asked the question.
Yeah, or even, like the connection between the jaw, the hips, and the pelvic floor are also really connected. So if you have a tight jaw, you're not going to want to do these, not that we do jaw exercises, but it's not like you want to be chewing like really hard all the time. You want to learn how to relax your jaw in the same way that you'd want to learn how to relax your pelvic floor. At different stages of life, strength and, release are more important. So actually we'll talk about, menopause in a little bit. That's when your muscles may start to weaken. So you need to be thinking more actively about strengthening, but not at the expense of length and release and relaxation. And so our clinical team often likes to say the most important pelvic floor exercise is not the Kegel, it's actually the diaphragmatic breath. It's how do you learn how to release and to let go? Because then from there, you can build strength afterwards.
Okay. Oh, I love that. So now let's go on to the next phase.
So, not everyone is going through pregnancy, but for those folks who do, that's probably the easiest and most common entry path into understanding your pelvic floor because there's no way around it. Even if you're delivering via cesarean, there's a lot of pelvic floor, both strength and impact that can happen there. What I'm experiencing right now at 37 weeks pregnant is a lot of pressure on my pelvic floor, from the weight of the baby. And so both strength